Good morning. My name is Vaijantee Belle. I'm neurologist at Olean General Hospital. I'm also the medical director of stroke program and clinical neurosciences services at Olean General Hospital in Olean, New York. This is a live presentation as a part of mini med talks for the community education. I'm going to talk about stroke, also called as brain attack. In this presentation, I'm going to cover three important aspects: how to identify stroke symptoms, how to prevent stroke, and how to avoid the stroke altogether. Let's start. We all know stroke is an important public health burden. Stroke is the third leading cause of death. One person, as we speak, dies every 3 minutes. 163,000 people die of stroke every year in America. Stroke kills more than twice as many American women every year as breast cancer kills. Stroke is the leading cause of disability in adults. Out of 4.4 million survivors of stroke, only half, or a little more than half, of the stroke survivors regain functional independence. It is estimated that the direct or indirect cost for treatment of stroke as early as 2007 was $62.7 billion. It would be far more now. 14% of the person who survived the first stroke almost sure to have another stroke within 1 year. What is important to understand that stroke is not inevitable or irreversible. Stroke is certainly a preventable condition and can be aggressively treated if certain points are kept in mind. So what is a stroke? We would like to call stroke as a brain attack. Just like when we talk of heart attack, we understand the urgency and importance of calling medical help, which enables us to survive and, in case of stroke, also minimize the disability. So a stroke or a brain attack occurs when blood flow to the brain is interrupted by blockade of a vessel or a bursting of a blood vessel. So brain attack or stroke is recognized as abrupt onset when you see sudden change in the person's presentation. So abrupt onset of neurological deficit, that is stroke. And what it indicates that there is a loss or impairment of function in the damaged part of the brain. As you can see in this figure, different parts of the brain control different parts of the body and different bodily functions. Therefore, stroke in that area will give rise to impairment of those respective functions. It is good to remember that left side of the brain controls right side of the body, and it also controls the speech and language. The right side of the brain controls the left side of the body, and it is also responsible for spatial and perceptual understanding. Grossly, there are three major regions of the brain: cerebrum, cerebellum, which is also called as a small brain, which is in back of the head, and deep inside is the brainstem, which is a conduit of all the nerve fibers from the brain which go to the spinal cord. It is also responsible for maintenance of blood pressure, respiration, and other important functions. So what would you see if you're having a stroke? Usually, such presentation involves abrupt onset of unilateral weakness, unilateral numbness, visual deficit in the form of suddenly a blindness, double vision, difficulty to look on right or left side, slurred speech, impaired language, confusion, impaired comprehension, uncoordinated gait or clumsy movements, sudden cognitive impairment, confusion, or drowsiness. As they say in real estate, it's location, location, location. What that means is that a small stroke in a crucial area can cause a devastating impairment, a disability, or death, as against to a relatively larger stroke in another part of the brain may not cause much deficits. What is important to understand that time is brain. What I mean by that is every second the blood supply is interrupted to the brain, 32,000 neurons are dying. Add that one after other, every minute 1.9 million neurons die, every hour 120 million neurons die. By the time the stroke is completed, there is loss of nearly 1.2 billion neurons. Therefore, blockage of one blood vessel, if it lasts for 5 minutes, that can cause a complete ischemia and death of that brain tissue. As you can see in this picture, there is a blood vessel depicted in the red supplying part of the brain. The yellow structure inside this blood vessel is the clot. The blood is interrupted, blood supply is interrupted in part of the brain, which is shown in the colored area. The black tissue is the dead tissue which forms the center of the stroke. As the time goes by, more and more blue part of the brain, which is penumbra or a tissue at risk, which is barely surviving, gives away, and the dead tissue expands. Therefore, revascularization or restitution of a blood supply in this area can salvage this blue part of the brain and minimize the amount of dead tissue resulting from the stroke. This is a slide showing the graph. On the x-axis, it is the minutes from the stroke onset to start of the treatment. On the y-axis, you can see the improvement that has occurred after the treatment. As you can see, the maximum improvement is seen when the treatment is administered at 60 minutes. As the time goes by, the extent of improvement is seen to be rapidly declining, and at the end of 3 hours, it is almost as good as if no treatment has been delivered. Therefore, it is important to understand that we recognize the stroke symptoms as early as possible. The National Stroke Association recommends using FAST method for recognizing and responding to stroke symptoms. The FAST method has been updated to other acronym, BFAST. B stands for balance. Do you have a sudden loss of balance? E stands for eyes. Do you have a sudden loss of vision in one eye or both eye or a part of the visual field? F stands for face. You can look yourself in the mirror and give a smile. Does the person's face look uneven? A starts for arm. Is one arm weak or numb? S stands from speech. Is the person's speech slurred? Do you have trouble speaking or trouble understanding the command? And T is most important, time. If you find any of these deficits, you have to call 911 immediately. This is a simple method you can see. If you feel there is an abrupt onset of change or abrupt change in your body, you can look at the mirror and see and give a smile. If your face appears crooked or asymmetric, that satisfies the F part of the BFAST. You can also raise your both arms as seen in this picture, and in the next picture, you can see the woman's hand is dropping. That means she has a weakness on the right side. Then you can say to yourself any sentence. In this example, it says the sky is blue in Cincinnati. Inability to see this sentence, inability to say this sentence clearly or not able to say it at all indicates the speech is affected. It is estimated that these simple measures you can accurately detect the stroke almost 80% of the time. So if you notice any change in case of yourself or your loved ones, see if they can talk okay, if they can reach out with their hand okay, if they're feeling okay, if they're able to walk, if they're able to see. And if you see deficits in any of this occurring abruptly, this may be a stroke. Just like a heart attack, if you have such symptom, you have to call 911 and say, I think my patient is having a stroke. It is important to say the stroke because it activates the EMS dispatch and also the hospital to ready to receive you and administer urgent treatment. The treatment could be in the form of giving an IV clot buster, it's also called as TPA, or it can be even a mechanical retrieval of the clot. In this picture, you can see this clot, which is removed from the patient's artery this way. And that in this case, the patient had a complete recovery of hemiplegia or a weakness. What are the risk factors for stroke? There are few factors which are modifiable and few are not. Of course, your age, your race, your sex, that gives you a certain non-modifiable risk. But what is in your hand is modifying or managing the other risk factors such as hypertension, coronary artery disease, diabetes, weight control, cholesterol reduction, exercise, use of alcohol and drug abuse, etc. This is a simple picture to say what you should do in your own life, choosing a healthy lifestyle to reduce the stroke risk, keeping the blood pressure low, lowering your cholesterol by taking the medication advised by your doctor, eating healthy food, exercising regularly, at least 20 minutes of a cardio exercise every day, treating sleep apnea, managing your diabetes, drinking in moderation, smoking cessation. Do talk to your providers if you want to go ahead with that. Avoiding stress and maintaining a healthy weight. That could definitely reduce your stroke risk, and not only of the stroke, but also of dementia. It is also important to understand sometimes a mini stroke where you develop these symptoms, but they resolve within 2 to 20 minutes. Those are also warning shots you need to recognize and contact your provider so that a further evaluation can be undertaken. If you have such TIA, you are high chance of getting a full-blown stroke in next 48 hours. So how do you beat stroke? By prevention, by managing risk factors and choosing healthy lifestyle, heeding the warning of TIA or mini stroke. Even if they're transient and even if you recover completely, it is important to act on it. And of course, increasing awareness, identifying stroke symptoms, and calling 911 immediately saying stroke. I hope you enjoyed this presentation. Thank you.